because we are having a ton of fun here because we have had some technical difficulties. Sorry to start late, you all, and want to welcome everyone, not just those who may tune in live, and there are thousands of you, little joke, but also we want to welcome those that are going to most likely tune in from our website or from YouTube or wherever you capture this webinar, to our families out there of hearing impaired folks that are our patients, to our patients, to our staff at retirement communities that we serve, our partners, if you will, in helping people here. Just want to welcome you. My name is Robert Smith, and at St. John's Hearing Institute, really our reason for living during the 8 to 5 workday, and our purpose is to reconnect you that have a hearing loss, that have been disconnected. And our secret is this: it's just a 3-step principle. We do our very best to listen to you because you're the real expert about your hearing loss. We shop for the world's best technology to treat hearing loss with. And then we're really old-fashioned in that we still, as a matter of fact, excel in rehabilitation. And to us, that's the key. Without that, we can't very well train you and walk beside you to be successful so that you can have your best outcome. So, topic of the day before we get started is please mute your microphones so that we don't hear your business coming through. Thanks so much. And want to talk about healthier hearing is going to equal a healthier brain. And I don't know how long you've been around in this crazy world, but remember the old saying, use it or I'll let you fill that in. And it's so true. It's so true about all of our body. Our body's one system. Our brain is a muscle and of sort. And when we don't use it properly, we're definitely going to lose it. So, have you heard, and according to a Lancet commission, that hearing loss is a leading modifiable risk for cognitive decline? What does that mean? I'm going to break it down. It's something we can do something about when we have a hearing loss, and it's the most influential modifiable risk for cognitive decline, simply meaning there are several things. There's a list below here, but it's something that has the most effect, as far as we know from the research, and on that we can do something about, that's going to have a potential outcome, positive outcome, on our potential cognitive decline. So keep that in mind, because I think it's all about this. So what is a hearing loss or a hearing impairment? It's just termed as a deafness or impairment. It's a condition that disrupts a person's ability to perceive sounds. And by the way, where at the brain. Hearing actually happens at the brain, and there are a number of things that can contribute to this, but most commonly the aging process. We don't want to talk about that very long, but it's the most common. And genetics can play a part in this, as well as exposure to loud sounds. So broad spectrum of things that can actually cause a hearing loss. And we want to unpack what makes a brain healthier by having healthier hearing. So just going to do a little diligence here in how hearing happens. So hearing is essential for cognitive function. It enables us to process and comprehend speech and other sounds. Really think about all the noises that happen in your day and in your environment. And I see a guy from Canada there. Welcome, by the way. You came a long way to be here. Thank you. So at any rate, think about all the signals that your brain gets through the gift of hearing and how that impacts what goes on in the brain, how it exercises that muscle and makes you aware of your surroundings. So we want to stimulate that. We want to exercise that, because we don't want to end up in a not using it and losing it situation. So and it's critical for social interaction, for communication. And so many times, gosh, COVID was such a hard lesson. And we watch people literally in our retirement communities that we visit pass away I heard so many people say, I don't want to live like this anymore, being isolated, shut off from their family members and even staff, people that they love. And this is super cool. It's exciting, in my opinion, plasticity. It plays hearing loss and hearing well play a role in brain plasticity. What is that? It's the ability of the brain to change and adapt. No matter what our age, no matter what our condition, we can still learn and we can still grow. We can still exercise and use parts of our brain and actually make them stronger. It's proven time and again, we see it on a daily basis with our patients. So, Carla, isn't this funny? We're having another little technical difficulty. I have inability to move my slide forward. Let me try it. There we go. There's always another way. Thank you. So take a look at the, gosh, I love it when things happen and there's always a way out. Take a look at the slide here, at the picture. And these are just MRI studies. I think these actually came from a woman named Anu Sharma at a University of Colorado, I believe. There's a lot of follow-up studies like this. On the left is half of the brain matter with a hearing loss. On the right is a normal hearing brain. And just in the visible appearance, it's really easy to tell they're different. And so cognitive decline has been linked to an increased risk of developing conditions like dementia, cognitive decline in general, and as well as depression and isolation. And we started to open up and unpack it. But if I don't hear well, it's going to cause pain in my life. It's going to cause pain in my relationships. It's going to cause embarrassment. Our patients tell us every single day that they don't want to socialize. We see so many patients in retirement communities, and there may be 350 to 650 people that live in that community, but yet our patients, when they don't hear well, when they're not healthy, they isolate in their room because they don't want to come up against that barrier of not being able to understand what's being said clearly. So that decreases brain activity and in the auditory cortex, and which is the one responsible for processing sound. So again, back to use it or lose it. Now, there's a ton of evidence. I've mentioned this in previous webinars and podcasts, that one of my favorite doctors in the country is Frank Lynn at the Johns Hopkins. And so many studies have come out linking untreated hearing loss and poor hearing to cognitive decline. And so I highlighted here the key risk factors for early onset dementia were identified. There are many of them, and including hearing loss. And again, that's the number one modifiable one. That's the number one thing we can do something about. And it emerges as a significant risk factor. And a lot of times I think when we visit our primary care doctor, we've got other things on our mind. We kind of silo our health, and we're there for that one thing, diabetes or heart or liver function, blood work, what have you. And in that 15 minutes that we have with our doctor, we don't always think of or get time to go through our whole list. And so hearing loss rarely ever gets on the list of symptoms and rarely ever gets discussed in the physician's office. And I don't think it's because they don't care about us, majority, but I think it's that there's so many things that we're working on in our body and so little time that we get to spend with our doctor. So let alone does it get diagnosed or talked about with our doctor. So we don't really have a vital preventative strategy to work with them. So it's not just for a quality of life either that we want to hear well. It's also for quantity, because I don't have it here today, but on previous webinars, I've shared the statistics, and people who hear well as we age live 2.5 years longer than people who don't. And as you think about it a little bit and you spin through it, so I have a hearing loss, I don't deal with it, I try to socialize, and I start to withdraw. And there are so many things and other health conditions around that literal walk to withdrawal. And so over a period of time, I start to lose my will, and one thing leads to another. So how do we protect our brain? And common sense, we'll get to that in a second, but it's essential for your brain health, because I'm going to show a couple pictures in a minute, which, gosh, I wish I could show our pictures of our patients. They tell such a story, but we've got to protect it and preserve that brain health by stimulating that brain by hearing well. So what do? We want to use protection measures. Even if we have damaged hearing, we still want to use earplugs, things like that, when we're going to get around noise. We want to have our hearing tested every year. We want to obviously eat a balanced diet and regular exercise, blood flow that feeds the cochlea, the inner ear. All those things are just, they're so linked. We're literally one walking system, and hearing is one part of the puzzle. And so diet and exercise are another thing that we can do to preserve and protect our hearing. But the key, I think, overall is we have much better patient outcomes when we start early, like anything else. When your heart hurts, you typically want to call your physician, and you may get referred to a cardiologist. And the earlier you get into the ER, which is not early, the better your outcome is going to be. And it's the same way with our hearing. So early detection and correction and aiding that part of your health is so important to staying vital all the way around. That just can't quite emphasize it enough. And I just want to back up, and I think, to me, this is my favorite part of today. Do you remember common sense? And hope you're smiling. I hope you do. If you're really, 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 really young, we might not talk about it a lot, but those of us who have been around a few years, look around and we see things that are just crazy in this world, and we think, where's the common sense? And I'm gonna put that label over our hearing, and I want to just show two faces. And what I love about this life is that I get to choose how I take care of me, how I take care of my bride, how we take care of each other. And this may seem a little bit extreme to you, but I want you to look at these two pictures. And as you look at the guy on the left, I want you to see, not only really focus on his facial expression. And if his face was a bicep, he would be ripped and we would be impressed. But this is a really hard life for this man to live through. He's struggling connecting to life, connecting to the people around him. And if we could see a picture of his whole body, you would notice that his whole posture is flexed and typically in the forward position. And as hearing loss progresses, we typically don't see this ourselves. We typically don't look in the mirror. Now, our wives will tell us, our husbands will tell us, our family members are happy to tell us when we're messing up. But so many times we just walk through life like this, and every day it just gets a little bit worse. We let it go, we let it go. And as we break open, this is the way we typically find our patients. And they really don't realize they've gotten this far. And I've done a really mean thing over the last few years. I've taken my little iPhone, and I know it's mean, so please, please don't send hate mail. But I'll take a picture. I'll take a video, actually, of the hearing impaired person's facial expression when we're giving word recognition tests. So they'll hear the word, they'll try and repeat it, and their whole body goes into this flex mode. Now, I don't like it, but I turn it around and I show that video to them, and they don't like it, but they haven't seen it. They don't watch themselves interact with people out here. And so they've gotten to this point and really not realized how they've gotten there. What I love, what I live for in this job is to take this guy on the left and turn him into the guy on the right. Now, both guys have wrinkles on their face, and that's apparent. But it comes down to which face do you want to wear? And when you look at the guy on the right, you look in his eyes and he's focused, he's clear, he's calm, he feels more confident. And one thing I notice and love about our patients by the time we get done with their rehab and treatment and get them into what we call maintenance, just flowing, just hearing well, their hearing health is optimized. They actually feel, perform, and will admit that they feel more competent because the information they take in is easier to comprehend and process and then reply to. And so their overall response is clearer, not perfect. Nothing's perfect. We can't replace what God has given us, but it's a beautiful thing to walk with a patient through this process and see that transition from the body flex to the body relaxing. And they're able to go back out of their room in retirement community or back out wherever their socialization is and engage and know that their hearing is as healthy as it possibly can be once we take them through the rehabilitation process and teach them all the techniques that they need to survive and to thrive. And that's the goal, is to not just to help someone limp along and survive, but to thrive. So I hope that makes sense. And I guess it's right here that I would want to beg you, that I would want to plead to you, that if there's someone in your life that's going through this, I just want to ask you to encourage them and encourage them to get checked out, encourage them to find someone that they trust. Selfishly, we wish everyone came to us, but we know that's not the case and it's not necessary. But take action somewhere with someone that you trust that's going to walk you through the process that you're comfortable with. And if that's not you that has a hearing loss, please be an advocate to someone and encourage them, because what I notice about the majority of our patients is it's hard. Life is hard. They have other comorbidities that they're dealing with usually as well. And one more thing just seems to be the straw that broke the camel's back, and they may not have the energy or the will to deal with it. And as an advocate, I can walk alongside them and maybe be that encouragement that they need to take care of them and have a great outcome and a healthier life and more enjoyment, because we're made to be here with people and we need each other, and communicating is vital. It's oxygen to us as humanoids. So I'm going to turn it over. And my grandmother beat this into my head. She was a great influence in my life. Where there's a will, there's a way. So many times our patients are in fear. Oh my gosh, how do I get treatment? Does my insurance cover it? It's going to be expensive. I know everyone I know has gotten hearing devices and they don't work, or cochlear implants and they don't work, or an operation and it doesn't work. And so many times they feel so defeated. But when there's a will, there is a way. So what we're going to do is open it up for questions. And Carla, you can keep the recording going for another few minutes. Does anyone have any questions out there that they want to ask before we sign off? All right. Well, Carla, you can, I'm going to encourage you guys, if you have questions, if you don't live in this state, it's okay. You can call us, you can email that email address. I encourage you to write that down. You can go to our website and correspond with us. Even if you don't want to see us and our providers to treat your hearing loss or to have it checked out, I want to encourage you to reach out to us anyway. If we can guide you in any way, if we can send you information or studies or ways to get healthier with your hearing or how to encourage someone, reach out. It's okay. You don't have to get your treatment here for us to try to help you and steer you in the right direction. So we're at stjohnshearing.com, or you can email Osborne, OSBORNE at sjhi.net, or simply call 877-226-1186. Just want to thank you all for coming. God bless you, and may He give you the strength to be healthy. We'll see you on the next webinar. Thank you so much. Bye-bye. You can cut the recording, Carla.